Hello, EMT students. Welcome to the College of Central Florida's EMS program. I'm Scott. I'm the program manager, at least at the time of the video. And today I'm going to be discussing uh, some expectations when you go to clinical. Now, I want you to watch this, but then probably come back to it in a couple weeks and watch it again, especially after you've done a clinical or two. Probably a lot more things that I'm saying are going to make a whole lot more sense. And so let's get into it. Um, so, and if I could learn how to click everything. So we're going to talk about what you should and shouldn't do at the clinicals. We're going to talk about the different types of clinicals you'll be going to, where you're going to be inputting your documentation. And I'm going to keep that really brief because we're going to go over that in class a whole lot more. Okay. And I think that it's a lot better when you're putting in clinical documentation that you have an idea of what you need to be putting in at that point. And we're going to practice a lot on that. You and your instructors are going to do that. We're going to talk about what to do if there's an emergency or an issue at your clinical, and we're going to talk about some pro tips about putting things in Platinum Planner. I'm not going to go too deep on that one because I think that's a whole separate video that hopefully we'll have done here very shortly. So some general rules about when you get there. Number one, make sure you park in the right spot. Make sure that you know, make sure you watch this, obviously, and make sure that you show up about 15 minutes early. Okay. I will tell you one of the biggest complaints I get is people show up and they park when they're not where they're not supposed to. And believe me, I get phone calls from security all the time about that. So make sure we tell you where to park. Go where they say to park. Okay. Leave the upfront spaces for the people that really need it. We can walk in. All right. When you do get in there, introduce yourself and tell them who you are, where you're from, and why you're there. If you're an EMT student, hey, I'm an EMT. I'm here for an EMT. I'm an EMT, and I'm here for the shift. And make sure that you tell them that you are an EMT, even though you got the red shirt on. Sometimes they will think that you're a paramedic student, and we'll get back into that a little bit more. But number one rule: be nice. I can't stress that one enough. Don't let your mood affect your manners. Again, be nice, be helpful, be courteous. All of those things that are in the Boy Scout law. Definitely, you need to do those things. Okay, because again, the experience that you get if you're not being a good student, believe me, I'm not definitely going to find out about it. All right, so the clinicals you're going to do as an EMT. All right, you're going to have 3 in the emergency room. They are 10 hours each. You're going to have 3 on the ambulances, where you're going to do 12 hours, and your instructor may or may not include a BLS inter-facility transport. I hope that they do because I think that you get a lot of good experience by going to that BLS inter-facility. You get a lot more interaction. Usually, these patients, I would say 95% of the time, pretty stable. And again, it allows you to practice your skills and abilities while in the back of an ambulance. All right. You're going to have one clinical where you get to choose what you do. So if you're leaning more towards the emergency room, you can do an ER. If you're leaning more towards the ambulances, you can do that. Okay. Um, Extra clinicals. Just remember, even though we have a lot of clinical spots, we unfortunately make sure everybody gets their fair share. And I will tell you, everybody needs a turn. And by the way, we do share our clinical ambulance rides with the Florida State Fire College. And remember that there are a lot more, especially EMT students. There are a lot more of you guys out there now. Used to we would only have a class of 24. Now the current semester when we were videoing this, we've got 60 EMT students. So, and that's not counting the other places that have EMT students. So again, if we can, we'll put you in those clinicals, okay? But just remember, everybody needs a turn. Everybody needs to learn. All right. Your goal. This is my little hand thing here. You're going to do 5. Okay. You're going to do 5 emergency room patients, and you're going to do 5 transported patients. By the way, those 5 transported patients, that is state law. We can't vary off of that one. Okay. You must have these. All right. But I will also tell you that the more patients that you get, the better. So we definitely want to do that. Now, there are a couple rules that are absolutes. We try to play by the rules, and if you've read your program manual, I hope that you have. I will tell you, because again, usually nobody reads the program manual until they get in trouble, and that's the worst time to read the program manual. But there are a couple of Mount Rushmore rules and Mount Rushmore sins that you can create while you're at a clinical, and I'm going to share those pitfalls with you so that you never, ever, ever do them. Okay. Now, here's the good news, guys. The last 2 hours of your clinical while you're at an emergency room is for data input. So if you get there at 9 in the morning, you're supposed to leave at 7 o'clock at night. From 5 to 7 p.m., that's the time that you can actually go do your reports. That's a great thing, okay? Now, if they need help in the emergency room, please put your documentation down and go help, okay? Because again, they might come grab you. Hey, we got a cardiac arrest coming in. Hey, we got a really bad stroke alert. Hey, we got a really bad trauma alert. You need to go you need to be in there for those things, okay? This is how you learn. If you see bad things, you're going to learn about the bad things, and more importantly, how to make these people better. And we want to do that. There are going to be some times, it's very rare, but we do have some times we're going to have to move you around, maybe within the department, within the hospital, maybe next door. There might have to be a time that we have to do this, especially when you go do your ambulance rides. We might have to move you from one truck to the other. I'm going to give you this phrase, semper gumby, always be flexible, all right? So if we move you, you're not going to get counted off for it again. But by the way, do not move yourself. You are not allowed to move yourself, all right? So if you decide to move yourself, you're going to get in a lot of trouble, all right? So usually the officer or the charge nurse will let you know about it. You're going to make sure that you clear that with the clinical coordinator, your lead instructor, okay? Most of the time, it's usually one of us giving you a call to say, hey, we got to move such and such. You do get an hour for lunch, and again, that needs to be taken in the midday of your shift. Please do not, you can't save it up for the end. You can't show up an hour late and say, oh, that was my lunch. No, you can't, all right? By the way, bad conduct, I will tell you, always equals a phone call to your instructors and or worse yet, me. And when I get a phone call like that, I can assure you that if you've done something bad, it will not end well for you. Okay. I have usually when I get a phone call, I personally take time out of my day to come and see you. And like I said, that usually doesn't work out too well for everybody. So, by the way, you never know where I'm going to be, or somebody from the college might pop in to say hi. And I will tell you, and they say, well, it's 3 o'clock in the morning, Scott's not going to show up. Well, Scott sometimes gets insomnia, and well, he'll put his clothes on and he'll go down to the ER and check on students. Yeah, I do that. All right. Um, Everybody, and I mean everybody, knows how to contact us. Believe me, they have no problem with it. Something about Perry, Georgia. I don't know what it is. I get a phone call. So, guys, again, leaving early or showing up late, I can pretty much guarantee you I will more than likely either A, know about it, or B, standing there. And you don't want me standing there, because if you're late and you didn't tell us, by the way, late happens. You get a flat tire, kids, something happens with the kids. Let your lead instructor or the clinical coordinator know, and they're going to put a comment in your documentation so that we know that you're okay. And I will tell you, if you show up late, or if I've caught you leaving early, I'll wait and let you put your documentation in, because that falls into that falsifying documentation part. And if you falsify documentation, guess what? That is like the Mount Rushmore of sins. That is the probably George Washington of sins. If you fake documentation, folks, I promise you that is the fast ticket out of the program. Okay. And if I'm starting to ask you questions about that, the other thing I can 100% assure you is I already have the answer. Okay. So guys, don't falsify your documents. Don't leave early. And then, because I'm going to let you turn in your paperwork. Okay. I'm going to let you, and then I'm going to show you the video where I was standing there. It's going to be a really bad day for you. Okay. If you show up, if you leave early, trust me, we find out about it. By the way, Platinum has geolocation for a reason. So when you get to your clinical in Platinum Planner, you're going to clock in. Okay. That's part of your clinical. It's not going to let you document until you clock in. So once you clock in, it's going to say, hey, I need to know your location. And you're going to say yes. And if you don't say yes, then you're going to be probably coming to see me. Okay. That proves that you were there. So when the state comes in and says, Hey, how did you know John Smith was there? Hey, look at this. I've got a map where he punched in at that time. Boom. Have a nice day. We're good. So you need to make sure that you do that. All right. Yes, and I will tell you that's how I do check on students that they got there on time, is I'll go in and look at it. Okay. So if you've had something happen, guys, make sure that you document in your notes why. All right. So you're an EMT student. The following are off limits. Starting an IV, off limits. Sticking a needle into any patient, off limits. Okay. Well, Scott, we're allowed to give auto injectors. Never, and I mean never, are you going to do that in an emergency room. Okay. Giving a medicine IV, IM, sub-Q, unless you've been specifically trained, we don't do it. Okay. And by the way, we didn't specifically train you. So this is my polite way of saying, while you've got that red shirt on that says EMT intern, make sure that you don't do that. Okay. While you're a student, not allowed to do it. Well, I'm a nurse. I don't care. While you're an EMT student, you have to follow those rules. Okay. Now, unless you have been trained to do something in lab, you should not do it. But if you watch something being done, this is great, like putting in a chest tube or putting it in or doing an intubation. All these are great things for you to see and watch and learn. Okay. Now, there are two big types of emergency room clinicals. There's the big hospital, super busy. And when I say super busy, I mean there's I'll give you an example. Advent has 52 beds, and there's sometimes 70, 80 patients in there. Okay, it's super busy. All right. Shands was notorious for we'd have 90 patients in the 50-room ER. Okay, and then there's the freestandings. These guys are a little bit, I wouldn't say slower, but they have a little bit less acuity patients. Although sick people do come in there, they are in all sense of the words an emergency room. Okay, they can do everything that every other emergency room can do. They just don't have no facilities in which to admit patients. Don't worry. That's why we have an ambulance come there, pick them up, and take them to those facilities. Okay. And again, just remember you got the last 2 hours for documentation. So documentation shouldn't be a problem for you guys. Okay. All right. Your ER clinicals, we have one rotation that starts at 9 a.m. and one that starts at 7 p.m., which is 1900 hours. Okay. And by the way, we don't leave early. I want to stress that. Go in there, if you're not actually having to document, then that's fine too, but you should be helping out in the emergency room. And I'll tell you that 3 to 5 hour is really probably going to be pretty slow. Usually after about 2 o'clock in the morning or 3 o'clock in the morning at these ERs, it really goes from busy to dead. It does. You do get an hour for lunch. Please make sure that you take that and take it midway in your shift. And again, please let the staff know that you're going to lunch, because if somebody shows up and you're not there, it's going to be, hey, where's John Smith? I don't know where John Smith is. Uh-oh, we got a problem. Okay. All right. While you're there as an EMT, you're going to assess patients. You need to look, listen, and feel. Sometimes we're going to smell people. Ooh, right. We're gonna help clean the bed. We're gonna help clean patients up. Do you want to sit there in your own feces? And neither does your patient. Okay. And yeah, it's not the most glamorous part of the job. Okay. But it's also the most humane thing to do. Okay. So definitely it is part of what we do, folks. And we need to learn how to do that and learn how to do it correctly. The big thing I want you to do is learn about pathophysiology. What is causing their problem? And more importantly, how we fix it. Okay, I can't stress that part enough. All right. The more that you understand that, I guarantee you, the better you're going to do in class, and the better you're probably going to do on the National Registry Test. All right. All right. So what's good to put in? What's a good patient to actually get a report on? My statement is all of them. However, anything with an alert, anything with anything that says arrest, really good things. Okay. Any serious bleeding, any respiratory patient that's turning colors other than pink, yeah, we probably need to go get that patient and do an assessment on them. And abdominal pains, man, because there's so many things that can be wrong. Learn how to assess the abdomen, especially when you got an abdominal pain patient. Okay. Now, with Platinum, our goal, and let me explain what Platinum is. Platinum is our tracking software. You also use it for your testing, but we also use it to track your clinical compliance, to make sure that all your labs and your clinical stuff has been done, and done in all of it has been done. Okay. And we can easily pull it up. We can easily do that thing. And I'm going to show you the example here. Is again, this is the Platinum Med. This is what it looks like. And what I have it pulled up on right now is actually for this is the EMT, but I've got it pulled up on the skills. And see, these are all the skills that you're going to do. Folks, we got 16 weeks to do all these things, okay? We're going to be doing probably 3 to 4 a day, along with some scenario work. This is normal, okay? I promise you, we've had people doing this now for nearly 3 years on this program, and we've got them all to 100%, the ones that wanted to get to 100%. But the two that I want to show here is the clinical skills. And the two clinical skills you have to do is you have to do 5 reports. There are patient assessment on emergency room and a patient assessment while you're doing a transport ride. Okay, so you got to have 5 each of those. Okay, and when you add this skill, it's going to say add an attempt, and that's what you're going to push to add however many patients. Now, what happens if I did 5 patients the very first emergency room I did? It's a possibility you can do that. But again, remember when I said more is better. Now, don't go hog wild. If you're putting in 50 patients, first of all, I'm going to show the paramedics how to do that. But again, part 2 to that is that again, our goal is to have everything at 100%. And I dropped that down too quick because what I really want to do is show you what 100% looks like. And so if I go back to Platinum Ed, and let's see here. And by the way, you can run this report too. But if you need to know where you're at and how many of your skills that you've done, you can go to reports and you can say, hey, I want to hit student report. And I'm going to go to, I know somebody that's done this. I want to bar Antoinette here. I think I actually already, I want to do all classes. And then the reason that she's not showing up is because I've already archived that class. Well, darn, I can't believe I did that. But you know what? I'm just going to say, let's do the whole class so you can see it. Move myself over here, run a report. And that, by the way, you do the same thing when you're doing your student report. Okay. You know what? I'm very sorry, guys. I forgot that I had to do that. But anyway, that is the process for which I'm doing it. Okay. And I'm going to show you maybe one of the paramedics reports. So we're going to borrow Miss Lou's class. And so now remember, guys, this is a paramedic class I'm about to show you. But I'm going to show you what we're kind of looking for and how it, more importantly, how it fills up. Okay, and let's hit run report. And we're going to wait here for a second, and then it's going to pop up. So these are all the skills that these folks have done. Okay, and as you can see, they've already got all of these people in here. But this is Adam's report. This is how many reports he's done. This is all the skills that he's checked off. And now here's the good news. See, as a paramedic, you've got a lot of skills. As an EMT, you only got 2. Okay, that's the assess people in the emergency room and assess people on an ambulance. Okay, those are the only 2 skills that you guys have to do, and the only ones that you have to worry about. But at the end of the day, everybody's report is going to say 100%, and that's what we want. So if you're missing something, it's going to say 0%. At the EMT level, it's going to say that. So make sure that you try to do that as much as possible. Okay. All right. Remember, ERs, highly interactive. Get your IV starts. Again, help out, because when you help them, they're going to help you. They're going to let you come in and play with all the cool things. All right. You're going to have a lot of autonomy when you're in the emergency room. That means you're going to get to go around and do things. I want you going and doing things, but I will also tell you don't abuse that autonomy. All right. So if you're going and hiding, trust me, that's when I usually end up showing up and go, hi, where's John Smith? I don't know where John Smith is. Uh-oh, we got a problem. All right. Now, before you leave, you're going to have somebody who has been precepting you sign all of your documents. So at the end of the clinical, you're going to hand your device that's got the form that's in it. It's already pre-filled in there. You're going to fill that out. You're going to hand it to them. They're going to fill out that form. And again, BJ or your lead instructor is going to show you guys how to do that. And once they do that, but make sure, don't go to the secretary. Yes, I know the secretary's names. Yes, if you put the secretary's name down, I'm going to send that report back to you and say, go get it. Go get it filled out by the right person, okay? So again, and by the way, most of the medics or nurses, they've probably been to CF or went to CF, and they're kind of familiar with the process. All right. Now, once you get to the ambulances, remember that you got the ambulances and then the interfacility transports. Okay, these folks are great, and by the way, the interfacilities, again, I can't say enough. Everybody thinks that that's a boring one. If you want action, but I can guarantee you, you might go to an ambulance station and you might get blanked. If you go to the interfacilities, I assure you, you're going to be hauling freight. Okay, you're going to be taking patients from one place to the other. All right. Remember though that you're always subject to call. So if you're one of those that gets hungry, bring a snack. All right. I would say probably throw some granola bars or protein bars in your bag, because sometimes when you get on a truck, it might be 12 hours of you going from the time you got there until the time they drop you off, sometimes literally pushing you out the door so they can go to another call. So guys, that day happens, and again, make sure you bring some snacks with you just in case. All right. You're going to come in when you go to a station. You're going to go meet the station officer, and they meet with the crew right about the same time. Okay. And you're going to meet with them. Usually the EMT, it kind of shows you around, tells you what to do. You're going to observe while you're on scenes, do assessments and reassessments with the patients in the back. Okay. Once you get done with the patient, you're going to come back out. You're going to clean the truck. You're going to get everything ready. You're going to debrief on every call. All right. That's talking to the EMT, talking to the paramedic. Say, hey, what was going on with this patient? What did I do? What could I do better? And again, remember, we've got to do our documentation, right? It's not done until the paperwork's done. Before you leave, again, just like in the ER, when we got the charge nurse or your preceptor to sign it, we're going to get whoever was precepting you that day to sign your evaluation. Okay. Reminder, it is your responsibility to get this done. I'm going to stress that again. It is your responsibility to get this done. If you don't get that signature, it's okay. I'm going to reject your paperwork, and that means it's like you didn't do the clinical. You're going to have to go and get that filled out. All right. Guys, make sure that you get that signed. But what happens if they went on a call? It happens sometimes, and you might have to go back to them. All right. So take the chance to get that paperwork signed towards the end of that shift, maybe within the last hour. Now, that does not give you carte blanche to leave. If you decide to leave early and I just happen to show up and you're not there, well, you're going to be answering some questions for me, and those very uncomfortable questions that you don't want to answer. All right. How long do we have to complete documentation? You have 72 hours. All right. We give you 2 hours at the end of an ER. I expect you to have your paperwork done before you leave the ER, okay? But we do give you 72 hours. But if there are times when you can't, something might happen and you can't get it done within the 72 hours. You need to get with your lead instructor in that case, and they're going to put a note in your documentation, because if I open it up and it says past due and I don't see that note, I just reject it. And once I reject it, that means that you have to redo the entire clinical. So let's not do that. Your time is valuable. And again, so make sure that you turn it in. And by the way, don't come to me with the sob story or come to your lead instructor with the sob story after the 72 hours. Please come to us before the 72 hours. And again, it's your lead instructor that's going to make the final determination on whether or not that he or she will accept or reject your thing. They have to physically open it back up, and you actually physically meet with them in order for them to do that. So in other words, it's kind of my point. Get your documentation in. All right. When you're working on an ambulance, by the way, you have to have your paperwork done before you leave the shift. All right. So again, make sure you get your stuff done. All right. It's a good habit to get into. If the team's not letting me do anything, can I leave? Well, the answer is simply putting it no. All right. This is a good time to watch. I don't feel comfortable with you knowing my location when I clocked in and out. Well, that's nice, but it is a program requirement, and it is proof that you were at the clinical, like we talked about a little earlier. Something happened at clinical. What do I do? Well, that kind of depends on the something. Check with the staff there or the station officer and the supervisor first. Check with them, and then if that doesn't give you the proper answer or you don't feel comfortable with that, get a hold of your lead instructor, then the clinical coordinator, then the program manager. Okay. Now, I'll give you an example. Let's say you get accidentally stuck with a needle. That's one of those things that we're going to need to know about because, yeah, something happened that could be potentially life-threatening bodily harm. You're on an ambulance and the ambulance gets in an accident. Yeah, we kind of need to know that. 99% of the time, the officers there usually call us, but you need to make sure that we know that, number one, I want to make sure you're okay. That's the absolute number one. Let's make sure that you're okay, and then we'll take it from there. But these are things. If it's something like, I forgot to turn in my paperwork 2 days ago, that needs to wait until we're banker's hours. Okay. Don't call me at 2 o'clock in the morning. I have a thing called the Mrs. Broderick rule. From 10 p.m. until 6 a.m. There better be a body involved is all I got to say. All right. So if it's bad enough to wake up Mrs. Broderick, and you will be waking Mrs. Broderick up, long and short, make sure that there is a need for it. If not, email works just fine, folks. By the way, email puts a time and date stamp on it, so we know that you turned it in when you turned it in. All right? All right. So how many patients do we need? 5 in the ER, 5 in the ambulance. Okay? Be nice. Be helpful. If you do that, you're going to be fine at clinical. Okay? And again, by the way, you're not their maid, but I will tell you, cleaning up is part of our job. So guess what? We need to learn how to do it and do it right. Okay? All right, if you have any questions, so in this order, your lead instructor is number one that you talk to, and the clinical coordinator is the second person you would probably talk to, although those two are kind of interchangeable when it comes to clinical. The only time you should be contacting me in all of this is if you can't get a hold of the other two and it's something life-threatening, something bad has happened, or you go to your lead instructor and it's something that they can't handle, and most of the time they call me, guys. So again, just understand that I've got literally 100 students right now, and as much as I'd love to see your smiling wonderful faces, again, coming to me with little questions, that's what you're learning a little bit about chain of command, right? If you are a firefighter, you're not going to go to the chief of the department and ask him about, where is the Halligan bar at on the truck. If you do that, I assure you, it's probably going to be a really bad day for you. So check it out with your officer first. All right. So hopefully that answered all your questions. And obviously, I'm going to be honest with you. You're going to have a lot more, and that's okay to have a lot more. But my point to this is guys, ask, make sure if you're not sure about something, make sure to ask the people that you're there with, ask the people that are working there. This is how we learn, this is how we engage. All right. And again, be nice, be helpful, and you'll be surprised how far that gets you. All right. And remember, these officers are looking at you, and when they go, hey, how was student John Smith? Oh, John Smith, man, that guy was jam up. Man, he was out there doing everything. He's out there washing the truck with us, man. He was just, by the way, you don't have to wash the truck with a truck. I think you do, but you're not totally required to. All right. But while you're there at the station, you need to be performing as if, but again, it doesn't mean that you're their maid. All right. That part I want to definitely stress. But again, the more that you can learn about the job and the more that you can learn about what you're about to do, the better off you're going to be. And when people see that you are doing those things, believe me when I say this is a very small, tight-knit community, and we talk to each other. Okay, so we definitely see those. We want you to have that. Okay, we want you to have that great experience, but also we want to showcase you and what you can do. And so that's what we're hoping that you get from this clinical experience. All right, 30 minutes, but again, don't be afraid to come back and watch this video, especially if you got questions, because once you probably do it one time, you're going to go, oh, okay, now this makes a whole lot more sense. So use this as a refresher as you're doing this. All right, good luck. I hope you have some great experiences out there, and definitely give us our feedback on this. And if you got any questions, again, lead instructor, BJ, myself. Okay, you guys all take care, and good luck on your clinicals.